I'm glad, oh, excuse me, it's afternoon now on the East Coast. In other areas of the country, it's morning. It's Jim Satterfield, President of Firestorm and CEO. Glad to talk with you today, and we're going to be focused on the CMS Final Rule. Time is really of the essence with a deadline that's coming forward, and we're going to share with you what this means to your healthcare facility and what are the requirements and what you need to make sure that you have in place. If this is the first time you've been on a Firestorm webinar, Firestorm is a crisis management firm founded in 2005. Our area of expertise is critical decision support. We follow a predict, plan, perform methodology to help you, to empower you to manage risk and crises. This is a shot of our home webpage. If you haven't had a chance to visit it, you certainly can find out additional information there. And you'll see there's a clock running right in the center of it under the title Rule Ready. And it gives you the countdown until the deadline that you must be in compliance with the CMS Final Rule or face the loss of all Medicare and Medicaid revenue. So there's a lot to talk about, and we have with us today Kevin Mac McIntyre. Kevin has joined Firestorm this year after an extensive career in emergency and crisis management in the financial services area, 20-plus years in healthcare. He served for a full career in the military, and his planning abilities and working and interfacing with first responders, FEMA, and others give him some unique insights into the types of things we're talking about. So, Kevin, it looks like there's a lot of things to do and talk about today. Step me through a little bit about what the rules of the road are today.
Absolutely. Thank you, Jim, for that kind introduction, and I just want to welcome everybody to today's webinar. Just a few rules of the road. We do have all members in listen-only mode. We will give the opportunity for questions toward the end of the webinar. We've created a shortcut document specific for your specific healthcare sector, as well as a self-compliance checklist, and we're going to make those available at the end of the webinar as well, and I'll give you instructions on how you can get those very important documents that we've created for you just for attending. And today we're going to keep it to 60 minutes. Firestorm has a history of starting on time and ending on time. We realize that you have busy schedules, and we want to keep it to 60 minutes today. So with that in mind, we'll just go ahead and continue. And I want to talk, I'm sorry, go ahead. Okay.
Nothing, go ahead.
Okay, sorry. I want to talk a little bit about the world we're in and how we've come to this CMS Final Emergency Preparedness Rule, as they call it, which, as Jim introduced in the beginning, we're about 4 months out from having to be in compliance with that. If you look at the preamble of the regulation itself, it calls out a number of things that have happened. The first one, of course, is 9/11. We have terrorist events, and of course, we've had subsequent terror events, not only here in the U.S., but around the world. We've had a number of outbreaks, such as 2009. We had the H1N1. We've had the Ebola crisis, which patients ended up here in the U.S. for treatment, and then we had some issues surrounding that. We have workplace violence, and from a healthcare perspective, you know, just a few weeks ago, we had the issue with the shooting up in New York. So we are living and breathing in a world that is increasingly, or it seems increasingly dangerous. And so one of the things that CMS looked at, as they looked at on the landscape of all the different kinds of healthcare facilities that are out there, is that there was a lot of unevenness in preparedness. So you had some institutions that looked prepared, but on a closer look, as far as their exercises or maybe some other elements that are covered in the rule were not being met. Some institutions had no plans. And so this, as we consider whether it's a man-made disaster, could be a chemical spill, could be a workplace violence issue, weather, as we know, we've had tornadoes, we have hurricanes, lots of different events can negatively impact our facilities and ultimately our patients, family members, and the community. So this is the reason that CMS has come up with this, I want to call it a beefed up rule. and they're trying to make the playing field and the preparedness across the different facility types even, so that patients, family, volunteers, everybody that comes in and out of our facilities are protected in case we have an event at our facility. So that's kind of the world we're in snapshot. Moving on now to our agenda. Sorry, go ahead, Jim.
I was going to just jump in and tell everyone, I forgot to say at the beginning, there is a toolbar to the right of your screen. And there's an opportunity, if you have questions as we're going through this, if you type those in, we will try to get to as many of those during the webinar today live as we can. If we can't, we'll reach out to everybody on the webinar and answer your questions directly. This is obviously a very complex matter, and we want to make sure that you get the answers that you're looking for today in this area. So I'm sorry, Mac, go on with the agenda.
No, I'm glad you stepped in. This is the second in a series of these type of webinars that we've conducted. And from those, a number of questions have already been submitted, and we've had the opportunity then to answer those back. So as Jim said, please type those questions into the toolbar there to the right so that we can address those toward the end, or I can at least, or somebody from Firestorm can get back to you with those critical answers that you need. So I wanted to talk about our agenda. We're going to talk a little bit about the CMS and go into a little bit more depth on that, actually quite a bit more depth. And then we're going to talk about how Firestorm can help. As Jim alluded to, we're a very seasoned and experienced crisis management company, and are stand ready to help you with the needs of meeting this new rule. And then at the end, as we've just discussed, we will have a Q&A period where Jim and myself will try to answer some of the questions that are input during the webinar. So moving on, so the CMS discussion. Right now, the date when this will become enforceable is November the 15th, 2017. And that date is very quickly approaching. We're about 4 months out. We had the clock up there a second ago. I think I've got another picture of it here on the slide here where we talk about our reality check. And 4 years and 3 months kind of presses us towards action if we haven't taken any, and increased activity toward preparations if we've already begun our process. So we just wanted to remind you, and we keep that up on our website until November, just to remind our clients and those that visit our website the criticality of getting ready, our facilities ready for when CMS will start enforcing this rule through the survey process. Now moving on, I mentioned earlier that there's 17 different facility types that are covered by this. And I just want to point out a few as we look at this. And if you have one of these facility types, or if you're involved with somebody that does in helping them get ready, then you're definitely in the right place as far as our webinar today. So naturally, hospitals are covered. We've got transplant centers here on the left side of the screen. Long-term care facilities who have some pretty heavy duty additional requirements based on this rule that have to do with permanently attached generators. Another one comes to mind that we're making sure that we cover is that in long-term care facilities and even home health agencies, there's the need now to brief the family members and anybody that's involved with the patient about what our emergency plan is. So these are some new things that have come out as a result of the CMS rule. On the right-hand side, again, we have home health agencies, we have outpatient rehabilitation facilities, critical access hospitals. These are the hospitals that serve the rural areas of the United States. It could be anywhere from 5 to 25 beds, so not your large metropolitan type hospitals, but critical access hospitals. And of course, they now also have to meet the new rule. And the one that I like to...
I was going to jump in for a second, Mac, and just remember where you were. I apologize for the interruption. The rules, the CMS Final Rule has different specific requirements in each one of these 17 facility types. And obviously, a hospital is providing a lot of this, and it's much more complex than a dialysis center. But as you think about those requirements, they're going to have significant impact, and being ready. And in some areas, there hasn't been this regulatory requirement prior. So understanding where you are relative to those standards becomes absolutely mission critical, because the impacts are so tremendous if in fact they're not in that case. So I think we'll share some quick steps that you can take that will help, but it is a much more complex pattern than what you've seen from a regulatory community before. And again, as Mac pointed out, this started in 2013 with an open comment period for a number of years. The final rule was issued last November, and the deadline is this November, and that's why we're so anxious to see that you have met those requirements and there will not be a disruption in your services. So I'm sorry, Mac, when I interrupted, but I think it's easy just to look at this and gloss over it. I do know that Mac has contacted CMS on multiple occasions with specifics about various facilities and the level of compliance that they must reach. So there's a lot of information to pull in a very short period of time.
I'm glad you brought that up, Jim, because one of the answers to the questions that I had fielded a while back and did a follow-up this week on is that CMS for noncompliance, and it really depends on the severity of noncompliance, has the regulatory authority to issue fines. So we not only have the specter of perhaps losing our revenue stream if we're not in compliance, but we also could face a fine. So I have information on that if anybody needs it. And we'll just go ahead and proceed through the webinar here. And Jim, thank you for jumping in and reminding everybody about the differences depending on the facility type. That also points out something else about our webinar today. I did mention at the beginning that we do have some materials, and so we have a fact sheet on each of the 17 different types that if you stay to the end of the webinar, we're going to tell you how to get the one that's particular to your facility. So again, Jim, thank you for jumping in. The CMS requirements. So these are the must-haves, and we'll get a little bit more granular as we move along. But you must have an emergency operations program, and it has to contain certain components. First of all, it has to have an emergency operations plan, or an EOP, based on a risk assessment. Now, in the healthcare community, we're used to thinking about the assessment piece as an HVA, or a hazards vulnerability assessment, and that has to be the internal hazards as well as the ones that exist in our immediate community. And then we have to have our communications plan, because one of the things that always comes out, whether it's in an exercise scenario or if it's a real world event, everybody ends up talking in the after action about how communications break down. And they fall into two categories. One being the technological breakdown, and then secondly, the actual messaging. And that has to do with how you put your systems in place to communicate not only internally, but with your community partners as well. And then in the rule, they also want a separate self-contained policies and procedures document. I think in the past, what was allowed was these can be embedded into your plans. They now require that to be separated out. And we at Firestorm, that's the way we've always written our plans. Anyway, Jim, feel free to jump in on this one, because when you embed those things, it can get a little bit confusing. Jim, did you have anything to add to that?
Well, I think a couple of things that are starting to come together. The majority of plans, and Firestorm reviews plans in all types of organizations, not just in healthcare, that we find that in the best case, they are telling somebody what to do, but then they don't tell them how to do it. And the requirements here are going to be much more specific than what you've seen in the past. So having those details there, separating out the policies and procedures is good to have that in a separate document and not in your emergency operations plan, because you don't want someone flipping through those materials when they really need to start to take action. So I think the organization that CMS came up with is meaningful, and it actually provides an easier use of operation. So you've got the emergency information where you need it. You've got how do you communicate, because what they found was that there was errors in communications in the middle of these emergencies and crises, and information that could be given out wasn't, and vice versa, and information was released that shouldn't have been. So they're looking for much more specificity than you've ever had to do in the past. The policies and procedures really should be pulled together in a framework document, and we'll show you how that lays out in a moment. But having that isolated together, and then make sure that your plans align to that at each step along the way. And I'll go and throw the last one in since you've got it up there, Mac, training and testing. There's a requirement here that all your people be trained, and training varies. Is this just what an employee needs to know? Is it what someone's on the emergency team needs to know, or in the senior leadership? What is it that they need to know? And it requires testing, and I know you're going to go into that in more detail with the 2 kinds of tests, so I'll be quiet there. But if you look at the bottom, the items that Mac has placed in green, that's really the ability for you to identify what are they looking at when they look at those documents in the blue up above. They're looking at first are the safety and security of your people. Secondly, the continuity of operations. Can you maintain the functions that you need to? If I needed dialysis and the dialysis center is not operational, this is a loss of life issue here. And then finally, protections of the physical assets. So if you think about it, it's people, it's operations, and it's facility. That's the way that they're looking at your performance in each of the 4 areas above. Those are the key criteria and will be the report card that you get as you go through that process. Back to you, Mac.
Thank you, Jim, for that. Let me move to the next slide here. So here on the CMS rule requirements and must-haves, just a little bit more on the hazards vulnerability assessment. And again, they want that to be based not only on your facility itself and the hazards within your facility, but also in the surrounding community, because we can be impacted internally or we can be impacted externally. So they want to make sure that during your hazard vulnerability assessment, you not only think about what's going on with your facility, but what's going on in the neighborhood and the community, and even to the point of identifying potential patients that may have special needs and things like that. So there's lots of thought process that has to go into the risk assessment / hazard vulnerability assessment piece of this. And then we're going to talk about on the next slide, the emergency operations plan. Now, I chose this picture because Jim alluded to the fact that I have a lot of emergency management and crisis management and a healthcare background. So I've actually been in this situation in a field hospital on more than one occasion from a real world perspective, and also as a player in full-scale exercises, and then as an evaluator, because another hat that I wore in the military was Inspector General. So I've played it from all, or done it from all 3 aspects. And so this picture here is kind of near and dear to my heart. And so if we think about our emergency operations plan, and I think Jim alluded to it earlier, it's not just what we need to do, but how we need to do it. You can imagine if we're expected to move out into the parking lot to do decon or decontamination, if nobody has ever put up the decontamination lanes before in your facility, that's going to be a problem if it's not been exercised, or if we haven't even planned to do that. What if something's happening in the community and we're about to get a surge? What do we do then? Or any number of events that we need to think about. And then we take the hazard vulnerability assessment and we write our emergency operations plan based on what we think could happen, or based on what has already happened to us. Because if you've been around for any period of time, you've already had an event, so you know what to expect. Jim, did you have anything to add to that?
I think when we think about surge and medical surge in a variety of areas, hospitals and facilities have had a good track record when the problem is happening somewhere else. I think when we look at the heart and soul of the CMS Final Rule is what do we do when it's happening to us, when we're at the center of this crisis, this emergency, this disaster. And that level of detail is a big change I think you're starting to see in coming into each of these areas. So what we've done in the past has been okay, but now the level and the standard and the bridge has gotten higher and higher as we move through it. I see you've moved on to communications. Why don't we start talking about that?
All righty. Sorry, I was quick on the draw there. Moved to communications. The reason I chose this particular, as we alluded to before, communications, either from a technological standpoint, which is this kind of illustrates, versus the actual messages, can sometimes have breakdowns. And so I sort of chose this communication box or box of communication equipment, and we see wires going everywhere. We probably have multiple systems that are running off of this communications box. I am not an electronic person, but I can imagine that whoever set this up, is trying to make sure that the operation has the communication functionality that they need to get through the crisis, whatever that is, through the emergency, whatever that is. We've put some words here around the picture, or around the image. We talk about technological issues, inconsistent language across the healthcare spectrum. Different people have different codes. A code yellow in one facility might mean something else in another, as an example. How are we operating as far as internal communications? Are we using phones, cell phones, sat phones, ham radio? What are the different technical aspects as far as that goes? And then how are we talking to our partners in the community, whether that be EMS, the fire department, the police department? We have to consider always when something's going on, what are we doing with the media? How are we managing that? And again, I alluded to already our messaging. So, Jim, did you want to say anything additional here, or just move on?
I think you have several topics there on the screen, and certainly are in the right space. It's who are our stakeholders, and then what are our issues that we're having to deal with, and being able to communicate effectively. So if you look at all of the threats and risks that you're facing and all the different stages of conditions, what are our messages? It's easier to edit than it is to create. So having those dealt with, then we don't have to worry about inconsistencies that come out. We don't have to worry about somebody trying to remember what does that code mean. While your medical staff may understand codes very clearly, others may not. And so we want to have a much stronger control in the communications area in order to be in alignment with the intent of the CMS rule. So thanks, Matt.
Thank you, Jim. Policies and procedures, and again, we've kind of touched on this already, so I won't beat it up a whole lot here. But Jim and I both discussed the fact that CMS now requires these to be pulled out if they have been embedded into your emergency operations plan or your communications plan. They need now to be pulled out and be their own separate standalone documentation. And these are the policies of your facility, but also the procedures. So it's the what and the how to in some instances. So again, the key fact here is that now this has to be a separate document, standalone, so that when you get your survey, you can say, here's our policies and procedures framework, separated out from our emergency operations, the rest of our emergency operations program.
And one of the things about that, I will jump back in and add one observation. You know what you know, and you know what you don't know. It's the what you don't know that you don't know. It's the big exposure here. So you've written policies and procedures. You've been running your facilities for a while. but what have you not included in there that you must include? Where are the gaps, and what is your plan to make sure that you have identified the gap and addressed it and have the language and materials that you need identified there? So that's a little bit more complex than just editing out of what you've already got. It's now then bringing those over, getting them organized, and figuring out what are the elements that we didn't address that we must have addressed. And that'll lead right into the training and testing slide that you had up next, Kim. So take it away.
Thank you, Jim. This is actually a picture of a tabletop exercise that was conducted talking about the Ebola crisis. So again, when we were talking about our what's going on in the world slide, I mentioned Ebola. And actually, I think there's still some action going on the continent of Africa when it comes to Ebola. So there was a lot of things that came out of the Ebola crisis, and one of them was as simple as PPE. So your personal protective equipment and how you don and doff that. And there was a lot of confusion. Talk about communications. There was some confusion about that. So in our training and testing program, we want to, number one, ensure that we meet the CMS requirements. So let me tell you what that is. So the requirement for CMS is to conduct at least one tabletop exercise before November 15th, and additionally one full-scale exercise that involves the community before November 15th. And there is an annual requirement that everybody in your facility, including your volunteers and all your staff, have to know and understand what your emergency operations plan is. And I'll put my IG hat back on for just a second. So when they come and do the survey, yes, they may ask the chief nursing officer, well, what's your emergency operations plan? We would expect somebody at that level to be able to rattle off, or at least go get the manual and pull it out and say, here's what we do. But they're going to go down to the level of the person on the floor taking care of the patients, and they're going to be asking them those questions. So we have to ensure that our team and our members, our nurses, our doctors, the people that are actually providing the care at the point of care also know what the emergency operations plan is and what their responsibilities are if the sirens speak. Jim, anything to add to that?
Well, I think all the four areas that you talked about come back to those three key criteria: people, operations, and facilities. And in the testing, making sure that you have documented the test, identified the gaps, put the corrective actions in place to address them. If you're doing a full-scale scenario, which you're now required to do, making sure you take photographs, that you have the scripts that you were using, all of the additional information, so that you'll be able to show in an audit where you are in compliance or not. If you look at all of this, this is a fiduciary governance responsibility within all of our organizations to make sure that these elements and bases have all been addressed and done. So I think you kind of built the stage of where we are and what the rule says, Mac.
Thank you, Jim. So fact or fiction? This is a little sort of participatory, so you can type in your answers to these questions into the box there that we alluded to earlier. Organizations are 100% ready to go. They all meet the CMS Final Rule. That's number one. CMS preparedness will not take a lot of time and/or resources. That's number two. Each facility has one person who is totally dedicated to emergency preparedness, and they have no other responsibilities. That's number three. All available resources to get the job done are completely free to each facility. That's number four. And leadership from the top down is totally supportive, totally in the know, and are 100% satisfied that if the Joint Commission or one of the other regulatory bodies that conduct surveys came by, we would be good to go. So question is any of that true? or not?
And
I think
Mac,
we all
I was looking,
the answer.
I checked with Bert typed some answers in as we were going through it, and looking at that, and he had correctly identified what you just put up, that this is in fact fiction. And we've yet to find a facility that has an unlimited budget and has, when we talk about resources, it's more than people, it's finances. So there's a big gap between reality and where we are. And that's why we want to make sure that you have this information, because when that deadline appears, someone's going to say, why weren't we ready? And that's the purpose of today's webinar. Back to you, Mac.
Thanks, Jim. Let me add just one more thing to that. You know, one of the things that has come through to me, I've had multiple discussions with probably in excess of 100 different people regarding this just over the last couple of months. And a lot of them are talking about, and no offense to anybody that's in a senior leadership position on the call or on the webinar today, they're having a hard time getting their senior leadership to understand where they are in this process. So I think one of the free tools that we're going to offer at the end will be very helpful in that, and we'll get into that as we move along. I just wanted to make that point, Jim. As Jim alluded to earlier, what is at stake? So this whole thing started December of 2013, and as Jim talked about earlier, there was a long, all the way up to about 2016, there was a long comment period, and they did receive a lot of comments. And they did make a few changes as a result of those comments, but not many. So this went into effect, became law in November of 2016, and they're going to start enforcing it with the future surveys starting November the 15th of this year. So if you're not in compliance, you have the possibility of losing your COP and your CFC, which means no more money, which could be bad. One of the things that I learned, that there's lots of facilities out there that fall into the 17 that rely very heavily on Medicaid and Medicare reimbursement for the services that they provide. Some of them are as high as 90%. On the low side, it can be as low as 60%. So this is a really serious, CMS is really serious about this. And the seriousness of us coming into compliance from a facility standpoint, I think this slide kind of brings that home. Anything to add to that, Jim?
No, I think that, you know, this is the bottom line. And I don't know of a healthcare facility that's saying, hey, we've got too much money and we're getting ready to cut our pricing. This is an area that we're all under financial duress and coming together. So let's talk about where we go from here. Are you ready? Are you sure? How do you know? Where are the gaps and what are you going to do about it? Those are the questions that I'm sure you're being asked, and Mac had pulled them together on the list here and to look at it. Every time we talk to someone, they say they're ready, and then we ask, well, are you sure? And how do you know? It starts to get a little fuzzy. And I think that's really the reason to do the webinar today that you're a part of, and it's a reason to do the analysis of, here's the question, where do you stand in each of those areas? And we'll talk more about how you do that in just a moment. But you've got to address those gaps, and not only just to be in compliance, which is important, but imagine the impact that would occur if your facility was not ready to operate at the time when they were needed the most. So let's get into the solution, Mac.
All right, so on this slide, we want to begin to talk about how Firestorm can help your facility. We've invested hundreds of hours, and literally decoding is probably the great word there. That's why I chose that image of the magnifying glass. The document that came out originally was hundreds of pages, and we spent a considerable amount of time decoding what exactly they wanted us to do from a facility perspective. So as we've done that, we've gone through, we've pulled out the the relevant information based on the facility types, and we've begun to put a program together that can help. So
and
just
when you get these guidance volumes, I was going to jump in, Mac. Mac had shared with me the 500 pages of the documents and their related rules that are cited. You have to go and look at each of those, and all the information's behind them. By the way, they did put out that they had a shortened version of it, but they shortened it by going to 6-point type. So you bring your magnifying glass that you were pointing out earlier to make that work. But there is guidance volumes out there, but there's different guidance for each one of the 17 different facilities. They're cross-referenced into references outside of it, like NFPA 110 and others. It is a complex problem that is going to need to be addressed and run to ground in each of those areas. So the research that Mac had referred to, the hundreds and hundreds of hours that our team has put into place, has read through all of those. We would encourage you to read through them yourself, but we've done that for you and can fast start it. Let's look at the next slide if we could, Matt. These documents, Mac created 17 different specific sheets that are shortcuts for each one of the individual 17 facility types. And it says this is what you need to do in the emergency operations area, communications, policies and procedures, training and testing, emergency backup power, and he referenced that earlier. There are some new requirements there that were not in place before, and the integrated health systems. As you look and think about those, there will be a summary document that when you share with us later your type of facility, Mac will see that you get that, and that will start to frame it at a high level what you need to do in each one of these areas customized to your particular facility type. What's next, Mac?
Thank you, Jim. Appreciate that. So one of the documents that we have created to help out, it's like when you set out on a journey, if you don't know where you are and you look at a map, you can't get to the destination you're trying to get to. And in this case, our destination is to be in full compliance. So we've alluded to some documents that we're going to provide to you at the end of the webinar. And one of we call our Dirty Dozen Self-Compliance Checklist. And what that does is allow you to do a self-assessment, and it's, as the name implies, it's 12 in-depth questions, and this is an image of that document, and it asks very specific questions based on the CMS rule, and it will give you a snapshot. Jim, do you want to say something about the color coding on this particular slide and particular document?
When you receive it, it'll be larger and it'll be easy, obviously, for you to read and go through, or we can facilitate that with you, and we're glad to do it at no cost to help in the process. But you think about, have you considered the area in the question? And if you answered green in that, that means that you have documented what needs to be done, you've trained your people, and you've tested it. If you answer yellow, you say, well, it's incomplete. We've dealt with some of that, but we've got some more that we need to do. And red means that it's either not done or it needs a complete revision. So when you look in these 12 areas and you answer those questions, this is the type of tool that you can then give to senior management to help them understand what you're doing and why you're doing it in that area. That's why it becomes so absolutely critical. Now, as we move beyond it, we want to know who is responsible for that area, each of those 12. When is the completion date? When did you complete it? Where is it located? It's in this binder, it's in this document, it's in this space, or it's on this part of the website. When was it reviewed? And when was the approval given to be used associated with it? And so those are all spelled out. So you'd have a single sheet. Imagine if you had an auditor coming in and you could turn this over to them and you've got green everywhere and they'd have all of the control information they're looking for. If you've got to say, we don't want you to wait until November the 14th to fix that. We need to deal with that now. Let's move on, Matt.
Thank you, Jim. Well, What we've done is we've created the CMS Digital Toolkit, and it covers all the components that CMS is requiring. And what we have is a 7-volume set, and it starts with the introduction. What the Firestorm team did with this introduction is we broke down into a very nice synopsis of what the requirements are. So again, this is kind of a starting point with volume 1 there, and you kind of figure out, okay, well, this is what CMS is saying, this is why they said it, and here's what we can do about it moving forward. And then in volume, go ahead, Jim.
Yeah, I was just going to say and clarify to look at this, and I cut you off as you were about to say exactly what I'm going to say now. You've got the introduction. You want to give that to your senior leadership team. That's going to help get them on board with what you're doing. The how you use this toolkit, or as a step-by-step guide of how you take this information and complete it for your facility. That's very important because, as we pointed out earlier, not every one of those components are required in every type of facility, and you don't want to miss the area that's most important. We've developed a new hazard vulnerability assessment tool and matrix because it requires that your plan be based upon a thorough risk analysis of where you are, and I think you're going to find that this will be very refreshing and also give you more credibility within your organization of how that's dealt with. And then the next volume over is the policy and program framework. Instead of you having to go out and figure out what a policy is, you're going to get those base elements. You certainly can add in others that you have within your organization or facility, or if there's a substitute of one that you would like to do, but you're not having to go out and start from scratch and do that, and that's doubly important in the time frame that we have left, since we're just about to go through that 4-month window. The next slide shows the other toolkit elements, the emergency operations plan. Now that's probably the longest section within it, as you can imagine, and it's by far and away the most complex portion of it. The communications plan that you would need, and then finding the training and testing plan. How are you going to do the awareness, some materials to do the awareness training for your employees, some samples of the tabletop exercise, the way to evaluate an exercise with a hot wash afterwards, and then a scenario for doing your full-blown event. But if you can imagine, the closer that you get to the November 15th deadline and the need to do an area-wide or facilities, multiple facilities type of a scenario with first responders, is going to become a significant barrier. So you can't afford to wait until the last minute to see those elements coming into play. So there's a lot here, and it's organized in a simple matter for you to go through and then customize for your individual organization. The next slide, I think, lists some of the components associated with it. You get a license to this program for the first year. You get Crysis Stop available for you 24/7, 365 days a year. Crysis Stop is a program that Firestorm provides so that if your organization finds itself in a crisis, you can pick up the phone and we're available to you to help you. And the STOP stands for stabilize the event, trigger the resources that you need, opine on the consequences, and prevent you from making the common mistakes there. So you've got a crisis management firm at your beck and call and providing that critical first hour of support at no additional cost. There's 10 hours of virtual planning training on how to go through and complete the modules that you've just seen there, though. They're divided into 4 2.5-hour sessions that is recorded so that you can refer back to it as you go through it. There'll be quarterly updates and webinars throughout the year because there will be new interpretations. We're seeing clarifications coming out of CMS. This is a moving target, and you want to make sure that you're prepared in each individual area there, and we can share the lessons learned across a wide range of facilities. There will be an annual virtual exercise that all of the facilities can participate in, and it will count as your tabletop exercise, but it gives you a chance then to benchmark how does my facility do versus my peers? There'll be access to a recorded employee training that you can then share with your organization. It'll be a voice over PowerPoint, and you can carry that out. Virtual storage of your plan. When you've customized your plan, you can send that back to us. We'll maintain a copy. You'll have a copy. Therefore, if there was a problem that developed down the road, we would have access to it and can provide you if something happened to your servers and your facility, plus having a backup review. We'll do a 1 hour one-on-one telephone consultation with you after the process to help address any gaps or concerns you might have. And then we'll do a facilitated self-assessment. Now, that'll be more comprehensive than just the 12 questions that you're getting, so that you'll have a detailed report back from an independent party showing that you have a CMS conformance certification from Firestorm. That'll go a long way when your audit comes and those areas will come in. If in the findings report there's recommendations and an action plan, you'll have that. So the sooner you have it, then the more comprehensive your response can be associated with it. So all of those components are included in the toolkit. The next slide up, Mac, if you would. Here comes the pricing. The pricing is $7,500 for the toolkit. There is a discount for those facilities that have ordered in the month of July. You'll see the savings and the net cost. In August, the discount goes down, similarly in September and October. And in November, it'll be a full price, and those people will be scrambling to get everything done in the last 2 weeks. So there is a significant opportunity here, instead of having to invest the hundreds and hundreds of hours to make sure that you've done everything, to have it organized, to have the toolkit, to have the master documents in place, will facilitate those areas for you greatly in this process and moving you through. So I think as we go on to the next slide, Matt, there is time for questions and answers. The license will be updated for the second year. There'll be a license fee approximately 50% of the first year license. But the advantage here is you don't have to worry about being out of date. You will be in compliance at every step along the way. So we covered a lot of points today and tried to address them and give you a step-by-step process to make sure that you're in compliance. We've recorded the session today so that if you need to share some of this information with someone else in your organization, we can easily do that. Just check with Mac. Now, the next slide up, Mac, is telling everybody what they need to do at this point, and that's to email us your facility type. We've gotten some information about you just from your registration, but to make sure we send you the right initial document so you can look at it for your organization facility type. And we will send you the self-assessment compliance checklist. That's those 12 questions, so that you can go through those. So the shortcut tool gives you that high-level view of what you need to do for your facility type. Then you can do your own self-compliance checklist, or we will do it in conjunction in an interview for you. And then we'll be glad to answer questions. Mac's going to be reaching out to everybody on the call today to answer your questions. If you need something beforehand, you can send us an email at cms@firestorm.com. This is a critical time. Yes,
Jim, I'd like to offer as well, and we haven't done this before on the webinar, but I know in speaking to some of our participants in the month of June, they forgot to write down the email address and then wanted to get in contact with us, but we're unable to. So I'd like to go ahead and give out my my phone number if anybody wants to call me direct and talk to me. So that number is 404-723-3963. And if for some reason I don't answer the phone, which is not my habit, but if for some reason you get my voicemail, just please leave a voicemail with your contact information, and I'll get back to you as soon as possible. That's a lesson I learned from last month, Jim, and I just wanted to make that available to everyone.
Right. As you can imagine, we've been spending a lot of time specifically on this, but given the criticality and time frame that is available to do it. There is an Irish blessing that says, you know, may you live in exciting times, or maybe that's an Irish curse, may you live in exciting times. We turn on the television set and we see stories about violence. Mac referred to the shootings recently in the hospital. We see terrorist events occurring around the world and moving onto U.S. soils. We see fires in the West. We see earthquakes occurring. We see the start of the hurricane season. We look at a variety of different exposures that are coming at a faster and faster pace. Medicare and Medicaid through CMS looked at where we were in the healthcare industry. And they said, you guys aren't ready if it happens to you. You need to get ready. They said that in 2013. They repeated it in 2014, again in 2015, and in 2016. And while healthcare facilities were asking for an extension, they took the position there could be no more extension. So the deadline for November 15th of 2017 isn't going to go away. It's not like something that was developed yesterday. We checked with the administration. We worked with one of the largest insurance brokerage groups in America. We've gone back to Homeland Security and said, well, with the change in administration, is this going to get delayed? And they went back and found out, nope, it's not going to get delayed. Now, you may not get an audit on November the 16th. You may not get a survey question on November the 16th. But at some point, if you can't prove that you have done these things, then your ability to receive Medicare and Medicaid payments goes away. We've reviewed all of the public information that's been available on questions that have gone to CMS. We looked at all of the public comments, and repeatedly there were these questions about, does it apply to me? And every time CMS was answering yes. We had particular questions in other industries, and as we looked about the edges around it, and we found that. I was on the phone yesterday with a large organization in California, and we were doing a project for them, and I said, does this need to be completed to be in alignment with the November 15th CMS deadline? And they said, we absolutely have to have it. If we don't have it, we're going to lose our funding. You do not want to be at a point or place your organization in a point where that could occur. The difference here is you're aware of it. It's been publicized in all of the government releases. It's in the media. It's public knowledge. Failure to comply means that you didn't follow business judgment. Now, that's a strange statement. Why would I say that? What we have found is that in many cases, the business judgment rule will void coverage under a D&O policy. And if you don't have your coverage covered under D&O, that means your senior leadership and your board are personally exposed in this area. This is a critical time. We need to pull it together. You've got a short period to pull those things in place. If there are multiple facilities within your organization, there can be special pricing for the extra facilities that you have. If you're supporting in this industry, there are opportunities for us to team in that direction. Eric, I saw you were on one of the people today, and so if there's a way that we could team together with you and do something special for your client base. Don't miss the requirements that are here. They are unique in each one of the 17 verticals. Matt called out the need to have the generators attached in one particular area. You don't want a surprise in this one. Please let us know. I think we've answered all the questions that have come in so far, but we're going to reach out to everyone. So, Mac, why don't you do a wrap-up, and then we'll give everyone back their day. We've got just a few minutes left.
Thanks, Jim. I'll just repeat the two items that we're offering and how to get those. I've left the slide up that has the particular, we created an email box just for this, cms@firestorm.com. You could reach out to me and ask for those documents. Let me know what type of facility that you are working in, and I will send you the specific shortcut sheet on that I have extracted from the CMS rule, as well as the self-assessment checklist. And I want to reiterate something that Jim already said. Yeah, you can take that checklist and sort of answer the questions yourself, but I would recommend that you actually call me and get me on the phone and help me step you through that. And the reason I say that is because I'm completely immersed in this thing. And we can have discussions around the specific answers to the questions and so forth. So it'll give you that third-party sort of objective viewpoint as to whether you're really ready in a certain area that the checklist covers. So I encourage you to call me. Again, my number is 404-723-3963. I'm happy to speak to you. There's no charge for this. We are a business, but we also are in this business because we care about people. We don't want to see bad things happen to anybody. We want our healthcare facilities in this country to be as ready as they possibly can. So feel free to reach out to me, and I'm happy to talk to you or walk you through the checklist that we provide. Jim, I think that's about it, and we're almost to the top of the hour. So do you have any final thoughts?
I just want to thank everybody for taking the time out of your day to listen. And if we can help you get the message out within your organization, don't hesitate to reach out to Mac. We're available. We look forward to working with you. Thank you for taking the time. Thanks for all of the service that you provide within your organization and your community. Thanks, everyone. Have a great day. Goodbye.